Well-child exams are incredibly important medical milestones for students and for children, right?
I mean, you're talking about important things like a child's growth, well-being, and development. Those will be checked out at these exams, so it's important not to wait until late summer to schedule these appointments.
Everybody tries to do this, right? Our mid-morning pediatrician, Dr. Gigi Chawla from Children's Minnesota, is here with some information on well-child exams. Parents always wait till the last minute to try to, and you guys are jam-packed.
Yeah, we are. I think, you know, everyone tries to get those in when kids are out of school. Nobody wants to miss school for these appointments, but really try to make sure that ahead of time you're planning. A lot of these checkups are super important for other activities as well, camps and sports checkups.
They can be required, right?
Absolutely.
So with the little ones, you have to do it around the birthday for the shots and things like that.
Right.
So we kind of kept that trend going as our kids got older.
Exactly. So for little kids, you know, it starts and it's very regular every couple of months. But after age 2.5, then it's really much more annual visits, and we want to make sure that kids are really getting those visits accomplished. I think with sports physicals, people have a misperception.
You think you're done?
Yes, that you could do that every 3 years, but you really can't. That is, you know, for even your insurance company recognizes that needs to happen annually for preventative care.
So what's the difference between the sports physical, that kind of 3-year check-in? What happens at the well-child visit?
Right. So a lot of places around the metro area and nationally will offer quick sports physicals. And while good, it is not as comprehensive as we would like for it to be. A sports physical is only a component. The rest of the well-child, the annual visit, really is around making sure mental health issues are addressed, so we do lots of screenings to make sure that kids are managing to their day-to-day stresses in a way that is healthy for them. We're also, you know, looking at some things that a sports physical may not be looking at, like blood pressure or other things like that can be a precursor to something more serious.
Yeah, it's also a chance for parents to ask the doctor questions that you may have been thinking about, and for the doctor to get to know the child, so that they can say, hey, maybe there's something wrong since last time I saw that.
It is a relationship that works both for the parent and for the child, and so trying to, you know, keep with that same clinician if at all possible, so that your child feels comfortable and see that clinician as a trusted resource.
When you say child, what ages are we talking about?
So, you know, from a pediatrician standpoint, we're doing that from birth up until age 26, and so making sure that you know, we're talking about everything from routine vaccines all the way to sexual health, and making sure kids are not doing anything untoward.
All right, make those calls earlier than the end of summer.
Exactly.
And get it done.
Dr. Gigi, thanks so much.
Thank you.